Good morning, guys.
Morning.
Okay, guys. Uh, no, before we start, does anybody have any questions? Anything they want to ask? Okay. Hey, guys. And let us just start talking a bit about this, okay, our words here. And if required, that's okay, we may put a combining vowel, which is going to be O. Now we can, for instance, say abdominal, which would mean, yes, okay, will just be pertaining to the abdomen. Okay, we just said in this chapter here, we said, okay, yes, the abdominal cavity. That was when we talk about the abdominal cavity as it is, whereas, okay, yes, if we combine it with, yes, okay, the pelvic cavity was going to be, yes, okay, the abdomen. Oh, yes, okay, was our combined vowel, and then we go pelvic. Okay. There's, okay, now this would become, yes, okay, the pertaining to. Okay. But again, yes, okay, it's not going to only be pertaining to the pelvic cavity, but both the abdominal and pelvic cavity. Okay. Or organs or whatsoever. Okay, guys, we can go and say abdomen. LGA. There again, yes, okay, abdomen, yes, okay, mean, yes, okay, we can just say yes, okay, belly. Yeah, indicates that, okay, this whole term here is the name of a condition. And we already know what, okay, yes, as would mean. Painful or ache. So what somebody may, yes, okay, call bellyache, or some people may even say, yes, okay, this rigorous, okay, stomach ache can also be called abdominalgia. Is that clear?
Yes.
Yes.
Right. Okay. Okay. But then also, yes, okay, please keep in mind that, okay, as in some instances, okay, a substitute or word that actually is, okay, means the same as abdomen was lapar. Okay. please make sure that you know the difference between laparotomy and laparoscopy. Okay, guys? Is there anybody who is still in doubt about these two?
No.
Okay, good.
Are people normally confused about the two of them?
I should never say never.
Okay.
But like, okay. Okay. So that's okay, laparotomy. That's somebody still don't want to, it's okay. That's going to, it's okay, if they make, okay, it's a bigger or smaller incision. Or cut into the abdomen, right? Okay. Okay. The picture that we had in the previous chapter, that was okay, so we can say it's okay, it's okay, pretty extreme laparotomy. Now, those of you who have heard of, okay, yes, what they call cesarean or C-section, that incision that they make, although yes, okay, it is like this, but it's still going to be as okay, laparotomy incision. Okay. Whereas, guys, if they go scopically or with help of scopes, I mean, yes, okay, they're just going to use one scope, but that's when they will mean, yes, okay, go and see. Well, okay, yes, we have the abdomen, for instance. And okay, yes, they will make one small puncture hole, yes, okay, through which, yes, okay, the scope is inserted, and yes, okay, mainly, yes, okay. Usually, it's okay, just two, or worst case scenario, it's okay, three small puncture holes through which, yes, okay, they insert ports. And through those ports, the mainly, yes, okay, will insert, yes, okay, the tools that they will use to perform surgery on. But it's all going to be, as okay, seen under the view of the scope. Okay, but since that's okay, they use that for, as okay, for the abdomen, yes, okay, that's going to be called a laparoscopy. Ante, now the word ante, as we said earlier, is okay, or is okay, mean front. Most likely, it's okay, we take it as okay, as a positional or directional term. Especially as okay, the word ante can also mean as okay, before. Okay. Now another term, another word that has because it's okay, pretty much okay, has the same meaning. F ante will be pre. Okay. But it's not going to just okay be as okay, just interchangeable. In some instances, okay, yes, per standard, it's okay, we'll use the word ante. In some cases, it's okay. In specific scenarios, they will use the word pre. But basically, it's okay, they mean the same. And as we said, a term that means, that's okay, where we used ante was anterior, which mainly is okay, just will mean in front of. Right, okay. Where you mainly can say that, okay, yes, let's put this as, okay, was one is in front of two. Okay, and please, that's okay. All these positional terms as we talked about yesterday are okay going to be as okay. Taken is okay, or it's okay going to be considered as when we keep the body in the anatomical position. Where you mainly will say it's okay here if you take this, that's okay. One is going to be in front of two. Okay, now, well, okay, one may be as okay. Structure is going to be as okay in front or anterior to as okay. Structure two. Now, as I said, the word anterior can also is okay replaced by ventral. So both anterior and ventral both mean in front of. And I hope all of you wrote that down on yes, okay, your chapel or table 2.1. If you didn't, then okay, just do it now then. Okay. Where it says, okay, if it means use it in terms of, okay, yes, before, then you can say it's okay, ante, which means, okay, in this case, it would mean before. And we can go and say it's okay, natal. The L is just okay, our pertaining to. And the word nat here is mainly mean birth. Right, okay. Well, it's okay. Yes, okay. Some people may use the word pre. Like you can say prenatal vitamins. Okay. Vitamins that, okay, as people may take as a supplement is okay in, is okay during a pregnancy. Any questions, guys?
So you can use prenatal and antenatal interchangeably?
Yeah.
Okay.
Yeah, there's no like, okay. Or you can even say it's okay. And that's why it's okay. Some people just like what you call it, okay, prenatal scanning. Some people just call it, okay, antenatal. But when it says, okay, the opposite of ante then was post. Which you take it in terms of position, yes, okay, is going to be yes, okay, behind. But if you take it in terms of okay, yes, time or so on, so yes, okay, it will mean after. Okay. There, okay, yes, it becomes from post, it becomes posterior, which means okay, we just says okay, in the back of. Or we can say actually as okay, we just mean behind. Whereas okay, we use the word post as okay, as in terms of time, it's going to as okay, PTSD or postpartum depression. But when we say it's okay, when we use the word posterior, and I told you, in some instances, okay, the word posterior may be, okay, interchanged by what we call dorsal. Which means it's okay, just also as okay will mean the back or it's okay behind us. Okay, guys. Wrong. And of course, it's okay. If you need to, it's okay. We will have our combining vowel, which is O. Now they may say it's okay. Bronchus. That is mean it's okay, just the name. Now, what does bronchus mean? It's going to, it's okay because I mean it's okay will be early, roughly speaking. Right, okay. Now, bronchus, that is if we say that is single. Whereas, okay, if you go bronchi, that's again, it's okay going to be the name, but that's if you say it's okay if it's plural. The bronchus is singular, bronchi is plural. Yeah. I may even go and say it's okay. Bronch aisle, which means it's okay, there's going to be. Now here, this will become is okay, you're pertaining to bronch or bronchus. Okay. And main is okay because it is okay as it is a tubular structure. That's why it is what you call it okay, the bronchial tube. But if you don't want to use the word bronchial tube, you can just say bronchus. It will be the same. When you say bronchial, then you have to go and say, okay, bronchial tube.
What does it say next to bronchi? I'm sorry.
This,
Yeah.
it's a name.
Okay, sorry.
It's the
Thank
name
you.
of the structure, but that's when you check it as a plural. More than
Okay.
one, right? Okay. Because guys, okay, well, we practically as okay, well, how we can say it's okay. This is your bronchus. It will then split into bronchi, which then, yes, okay, will split into bronchi again. And so that's okay, the division go on and on and on and on and on. Ultimately, it's okay, we can say it's okay, at the very, very end, it's going to be, we can say it's okay, very small bronchi. And that's going to be it's okay, what we'll call bronchi, from bronchi, and then there's just go ols. So they're actually going to be pronounced as bronchiole. But what is it? What is that going to be? It's okay. We can say it's okay. It's going to be it's okay. Very, very, very small bronchi. Okay. And what you mainly as okay will find at the end of yes, okay, the bronchioles. If you say yes, okay, this was a bronchiole. you will actually, it's okay, find what we call, it's okay, the alveolar sac, which, okay, as a single can be called as, okay, the alveolus. That is if we take just one. Whereas, okay, if we go and take it plural, it's going to be as, okay, alveoli. Oh, not that kind of plural, sorry. So, guys, okay, as when you see, it's okay, the name of a structure, or where the name of that structure is finishing off with ole, O-L-E. That mainly means that, okay, it's going to be, okay, a very, 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 very small branch of the structure itself. You may see as, okay, a similar example in as, okay, what we call arteries, for instance. Says, okay, we may have artery, mainly as, okay, from artery. But then we go as, okay, so it becomes arteriole. Where you mainly will say as, okay, you had an artery. But as, okay, when that artery is, okay, branches out. Okay, yes, into, yes, okay, final, yes, okay, small, yes, okay, terminal branches. That's going to be, okay, what you will call an arteriole. Now, what they may do is, okay, they may use a scope. Which is me, yes, okay, that's going to be, yes, okay, the scope. And of course, yes, okay, the scope here, yes, okay, is going to be, yes, okay, hooked up to a TV screen. Now, what they have in this tip of the scope is going to be, yes, okay, a light source, and that's going to be, yes, okay, a camera. Where the main, yes, okay, can go in into, yes, okay, either bronchus. They can go into, yes, okay, each of these branches here as well. Yes, okay. So that's going to be, yes, okay, what they'll call, yes, okay, a bronchoscope. So the tool will be called bronchoscope. The procedure will be called bronchoscopy. Okay. So you mean, yes, okay, just used bronch with, yes, okay, the combining vowel and combining vowel. Okay. Now, what they may take from that is going to, yes, okay, if they come across anything that is of, okay, as interest, they may take, okay, as what you can call is, okay, a bronchial biopsy. Okay, they see some sort of mass. They may go and say, okay, well, okay, you know, we're taking you. Okay, so that's okay. Along with the scope, it's not just a light source and a camera, but it's okay also passes through which is okay. That's okay. A tool can be inserted through which that's okay. A biopsy will be taken. And what do we mean by a biopsy? Yes, okay, mean yes, okay, a specimen from a living person. Did you guys get that?
Yes.
Cervix. And of course, that's okay with the combining vowel. Oh, now as I said yesterday, guys, the actual word was cervix. Okay. But when we use it, that's okay, in context, it's okay, as a ruled word. And okay, as if you would like to, as okay, put attach any suffix to it. The X is going to be as okay, in this case, as okay, replaced by a C as in cat. Just because we can go and say it's okay. Cervical, which means it's okay, it's going to be it's okay over, but changing to the cervix. Now, what did this cervix, or what did the word cervix actually mean? Or cervix? That was neck. Okay, that was going to be neck. So yesterday we talked about okay, cervical vertebrae. Right, okay. Or we can even say it's okay, the cervical spine. Part of the spine in the neck. Is that clear?
Yes.
Right, okay. Now we also as okay said that okay as this word cervix, which means as okay or mean neck, practically as okay. But then we also says okay, for instance, something like okay as cervical cancer. And of course, okay, this was going to be cervical cancer, okay, not of your neck, but of the neck of the uterus. Okay. Now, if you do it this way and see that, okay, guys, this whole thing here, for instance, okay, was the uterus. Okay. Which part becomes just okay, what you can call as okay, because it's okay, the neck of the uterus is going to be this part here. Now, how do we know that this is the uterus? This means okay, the part of the uterus that is protruding into the vagina. So meaning is okay, the lowermost part of the uterus, which actually is okay, is protruding into the top of the vagina, is going to just okay be what you call the neck of the uterus. Or you can say it's okay, the uterine cervix. And it's most of uterine cancers, yes, okay, develops here. And that's why, yes, okay, this is an area that they use to take what they call, yes, okay, a pap smear. So when you say it's okay, cervical cancer, it will mean it's okay. Be referring to it's okay, cancer of the neck of the uterus. Any questions?
No.
Now the next word is conra, and of course that's okay with our combining vowel O. Now guys, I told you that okay, as condor is mainly as okay, just a fancy word for what we call cartilage. Now, what I also told you guys is that, okay, cartilage was an example of connective tissue. Now, when we say it's okay, convert as okay, and call it's okay in terms of tissue, it's going to be chondrous tissue. Everything means okay, see, okay, this here will be is okay, our combining vowel, and the US is pertaining to. And then we had tissue. So what we have, okay, in common words could call cartilage tissue, but technically could also be referred to as chondrous tissue, which was an example of connective tissue. Here. Now, if this chondrous tissue here, you can say it's okay, develops a non-cancerous tumor that we call a chondroma. Chondr from cartilage, and oma, yes, okay, tumor, which in this case is non-cancerous. Because cartilage was an example of connective tissue. Whereas, okay, as if the same cartilage as okay develops or we can call it okay cancerous tumor, or where the word cancer also can okay be referred to as a malignant tumor. That will now be called condor. O, and then we go yes, okay. sarcoma, because it is a cancerous tumor or malignant tumor of a connective tissue.
Can you spell out the non-cancerous one? I can see.
Chondroma is CHONDROMA.
Thank you.
So it's pretty much okay. Yes, okay, just your chondr, which is cartilage, and then it's okay, your oma,
Thank you.
which meant mass or tumor, right?
Yes.
Right? But here it's okay, it is going to be it's okay, a benign tumor or non-cancerous tumor. Anything else?
No.
Coxy. Hey guys, now we can go and see cranny. Oh, where cran or cranny means skull. Now, guys, first for USA, it's okay. We can do and see. Go and see. Cranny. L. Meaning it's okay, pertaining to, and what we wrote here is going to be it's okay, cranial bones. Okay, we will talk more specifically about this, okay, the cranial bones once we get to the skeletal system. But although it's okay, hey, we just says okay, use one word and say it's skull. Please keep in mind that okay, it's your skull is not made, it's just one, not one single bone, but it's actually made up of a total of 8 bones. Okay, some paired, some aren't paired, but they as a whole is okay. We refer to as the cranial bones because those are going to be the bones that makes up the skull. Did that make sense?
Yes.
Yes.
Okay. If you don't want to talk cranial bones, then we can talk about it's okay, the space inside the cranium, which is just going to be it's okay, the cranial cavity. Right, okay. Which is made as okay, the space that is going to as okay be made up of the cranial bones joined together, made as okay to form a room. Okay. And I hope everybody know that okay, what this cranial cavity stores is going to be as okay, the brain. Now, guys, back in the days, and okay, yes, they may still do it, may not. And okay, if somebody has okay needs surgery done on the brain, they will need okay as a craniotomy. And the cranie is okay, your skull. O here is, meaning that's okay, that you're combining vowel. And the word show me. Since because it ends with a Y as in young, that becomes a process or a procedure. But this whole word here is becomes okay, procedure. Whereas okay, the word charm or show me mean it's okay, what does that mean? Cutting into. Okay. Where craniotomy is mainly as okay, where the actual is okay. Let's say, okay, this was your skull. So, little skeleton. Well, that's okay. What the actual is okay may do is let's say the niche is okay, access this area of the brain or skull. Long live Home Depot. Because okay, which actually is okay is a handheld drill. Make small holes. And okay, through one hole, they put in a saw. A thin saw, put it out here, saw this piece, then they go on, go on, go on, go on, go on. And now you have a loose piece of bone that is removed. So now you have cut into the brain. Oh, no, sorry, into the skull. So that's what they call it, okay, a craniotomy. Or this procedure here may also be called a burr hole. Burrhole. So burr hole. So that's okay. You call it either craniotomy, or you can say, okay, a burr hole was made. This is probably okay named after the guy who was okay first. It says okay, introduce this procedure. Now, have any of you ever traveled sort of Westport in Connecticut on the Merritt? You may see a street that is called Burr Street. One of those bridges. It's somewhere between Westport and Norwalk, between those exits. So you see Burr Street or Burr Road or Burr Avenue or something like that. No. Maybe somebody should think twice before it's okay going on. No, but just okay. That's what they used to call it. Nowadays, they mean yes, okay, going away from the practice of okay, yes, naming things just okay after people and so on. So that's okay. Burr hole is now just called a craniotomy. Okay, but usually it's okay when they say it's okay craniotomy. That's when they actually it's okay take off a piece of the skull bone. And some of you will go, so what do they do afterwards? Well, they put it back. They put that piece back where it belonged. And
How?
just like, okay, as you took it off, they keep it aside. Mostly it's okay in what you want to call it, salt water solution, just so it doesn't become dry. Afterwards, that's okay. They mean it's okay, place it back. And it may sound a little bit okay, crazy, but it's okay. It's okay. It's steel wire. They may actually apply the sutures. just so that the bone stays in place. And it's okay, they will be there. That's okay, pretty much okay forever, unless it bothers the patient too much. And it was okay, well, okay, the bone is now joined. Well, okay, we can take out the sutures. So, yeah, but that's what they is okay call a burr hole or a craniotomy. If you don't want to go that aggressive, well, okay, not you, but the neurosurgeon. Okay, that's why actually it's okay. Also have okay as a possibility of what we can call it okay, cranny. Oh, scopy. So now you should, that's okay, maybe it's okay, but let's be looking at these words here. It's okay, see, it's okay, how does that make sense? Because cranial was your skull. And we can say it's okay. Yeah, okay, yes, we have the skull. Oh, here is made it's okay, just over, it's okay. Favorite combining vowel between crani, which is skull, and scopy, which is going to be it's okay, the procedure of using a scope. Of course, it's okay. They will help you. It's okay. Make one puncture hole or drill hole to put the scope in. But then maybe it's okay. Just maybe even just one or two small other holes. Two. Or it's okay for the tunes to do yes, okay, whatever procedure that they wanted to do. Of course, yes, okay, they will still have to, yes, okay, make an incision too. This is okay, pull the skin apart. Well, after that, well, okay, yes. I mean, yes, okay, just put the skin together and suture. Yes, okay, with the help of a scope, where yes, okay, the main, yes, okay, we'll look at whatever they're doing, yes, okay, on a TV screen. Did that make sense?
Yes.
Yes.
Okay, okay. So if you know what a cranial was, if you know what a scopy was, if you know what a scope is, well, okay, yes, you'll be able to say, well, okay, yes, cranial scope. That's the tool that they use to just, okay, do a cranioscopy. All of the cranioscopy, a procedure of, okay, yes, looking inside the skull with the help of a scope, which is mean it's okay, just a visualizing tool. Did you guys get that?
Yep.
It's good, good, good. Now epithelial. E. And okay, yes, we can have okay, yes, again, it's okay, the combining vowel. It's rarely used. Because usually it's okay when we talk epithelial, it's going to it's okay, become epithelial, which is will be it's okay, the pertaining to. Now, guys, I said that the word epi pretty much okay as means about. Okay. We had okay as what we call as okay an epithelial tissue. Now a common organ in the body that is going to be as okay a classical example of epithelial tissue is going to be the skin. Okay, so skin is an epithelial tissue. So what I said is okay, as far as epithelial tissue was concerned, you're going to be as okay found in the skin and the lining of body passages. As some people as okay may refer to as okay the lining of the body passages as endothelial. Where the word endo mainly as okay is going to as okay be inside. Or made as okay be made up of okay similar cells that we found in the epithelial tissue. Okay, now the type of cells, the variations, characteristics, so on. So we'll talk more about that in anatomy, physiology. Again, okay. Esophagus. Now that's okay here. The us mainly is okay, just makes it just okay. The name of the structure. Okay. Okay, as the word fag. Primary is okay meant to swallow. Okay, that's probably too many L's. Sorry. Twice. Okay. So that's okay. What the esophagus becomes is mainly as okay, just a tube from your throat to stomach. Okay, what we said was okay, yes, it runs in the thoracic cavity. But they probably as okay found as okay determined as okay what its function was the first time they saw it. Because yes, okay, in terms of yes, it has something to do with swallowing.
So does the word ESO, does that have like a specific meaning?
I don't worry about that.
Okay.
What we mainly as okay said was okay, since fag is swallowing. Previously as okay, we talked about dysphagia. which means it's okay, there's a condition of, now here it's okay, the word this mainly is okay, will mean difficulty in swallowing. Now there can be, yes, okay, different reasons for, yes, okay, why a patient may have difficulty in swallowing. But it's okay, one thing that, okay, which means it's okay, involves the esophagus. So it will cause the patient having, you can say it's okay, increasing more and more and more and more difficulty in swallowing is going to be souffle. And here we go and say it's okay, eel. Where eel becomes just okay, the pertaining to the, that's okay, esophagus. Okay, can either be as okay, esophageal cancer or cancer of the esophagus. If you don't want to go esophageal cancer. Another thing that we may see is okay in the esophagus can again be as okay, or we just call it okay. Esophageal, sorry. And we can see it's okay strictures. But it's mainly as okay in most instances, okay, due to as okay frequent injuries that okay, yes, the esophagus actually is okay develops narrowing at some point. Okay. And you, yes, okay, this can become, yes, okay, cancers. Last but not the least, yes, okay, we may have, yes, okay, something that we can call or refer to as esophagus means, okay, just from the esophagus, but EL is going to be, yes, okay, the pertaining to EAL. And we're going to say, yes, okay, what they call is okay, esophageal varices. A guy is okay here. These varices are mainly as okay, from the same as what we can call as okay varicose veins. So what they have in the esophagus, if you say it's okay, this is the esophagus. Very much okay as low as okay by the lower end. Pretty much okay as where it's just at the point is okay where it meets the stomach is a network of veins. Now these veins here is okay can become swollen. And those swollen veins are what we can just call as okay esophageal varices. Just like you have varicose veins, it's okay, primarily it's okay in the legs. And they may rupture or pop. And that's why it's okay, a patient is going to just okay throw up fresh blood. That can be one of the reasons. But it doesn't necessarily have to be okay be the varices. That can also okay be okay a tumor that has started to bleed. Okay, guys. So that's okay. The suffix EEL. That's what we use for esophagus. That's okay, which is going to be the pertaining to. And then we just have okay different terms. Strictures, varices, cancer, so and so. Any questions?
No.
Good. Now we can just take as okay the next word, and I'm just going to write it right here. Which is going to be hepat. Show me liver. Now we can, for instance, say it's okay. Hepatic. Okay, which has become just okay. Pertaining to the hepat, which is the liver. Okay. You could say it's okay, our favorite hepat oma, which becomes tumor. And as that's okay, yeah, that is going to be a malignant or cancerous tumor of the liver. This hepatoma may also be called the, or people may also refer it to as okay, as hepatic. That means okay, just was okay, pertaining to the liver. And then they go and say it's okay. Cellular, which is again is okay, that's going to be pertaining to the cells. Which cells? That's okay, the liver cells. And then they go, yes, okay. Carcinoma. Where there's no doubt about it here, that's okay, that this is going to be, or that this is cancerous because it's called carcine, which in itself, yes, okay, was cancer, and thus oma is going to be, yes, okay, the mass. But yeah, it becomes just okay. Did that make sense?
Yeah.
Good. We could even say that's okay. Hepat. And go and say it's okay. Itis, which was mostly as okay inflammation, but in some cases, okay, could also be as okay infection. of the liver. Right, okay. Now, guys, as far as inflammation may be concerned, when we say hepatitis as an inflammation, it can be in two stages. It can be what they'll call acute. Now, usually it's when we see acute, it's something that as either happens suddenly. The acute can mean that. Or usually it's it may also if it's not suddenly, it's it's something that as only is going to last or only have lasted for a short time or period. Whereas the other kind of hepatitis can be what you call chronic. Again, it's here, or ick is or pertaining to, and the word chron, CHRON. Practically, it's means time. So usually it's when we use the word chronic, it means going to be something that has been long lasting. That's why you may hear some people say, well, I'm having chronic pain. It's been pain that I've been suffering from for ages. Did that make sense? So when you hear, as such and such condition is a chronic condition, it's probably going to mean that, this is something that's going to just, be a long, but just, lasting for a long period of time. Okay. For some conditions, because, you may say, things such as bronchitis. The first year or two when you have bronchitis, it's acute. Once you cross the period of 2 years or more, it becomes chronic. Clear? Okay. Now you are having what they'll call chronic bronchitis. And another thing that may be required for it to be considered chronic is not that we have had bronchitis for 2 years. But when they add up the the times per year or per 12 months in which you have had as bronchitis has to be a minimum of 90 days. So 1/4 of a year, you're going to have as episodes of bronchitis for up to 2 years in a row for it to be called chronic. So some yes, they have as unions, guidelines about just differentiate between yes, chronic versus acute. But usually it's acute is either used for something which occurs suddenly. That's why they say it's acute appendicitis. It happens pretty suddenly, right? Okay. What the patient starts starting having pain. Clear? Okay. So the opposite of not being long lasting is acute. And A means not or not. And everybody would know yes, what acute means. So acute is also equal to ugly. That's true. Okay. Okay, guys. Now, usually, guys, when we talk, yes, chronic hepatitis. Usually when we talk, it's okay, chronic hepatitis. You may have heard of a word called cirrhosis. Okay, guys? So when we say it's okay, cirrhosis, and there's no question about it, some people may go and go as specifically as okay, cirrhosis of the liver, or yes, again says okay, hepatic cirrhosis. But the word cirrhosis itself is pretty much okay as specified towards the liver or hepatic. So just writing hepatic cirrhosis is just okay overdoing it. Chronic inflammation of the liver. Right? Okay. And guys, usually that's okay in people, that's okay who have cirrhosis. That's okay. That's where it's okay. They're very likely it's okay will develop. It's okay. These esophageal viruses that can pop at any time. How and why and so on and so forth. Okay, we'll talk more in detail about that when we get to the, we can say it's okay, the circulation related to the liver. Okay. Or God forbid, it's okay in cases with okay as hepatoma, it's okay, liver cancers, it's okay. Even in that case, it's okay, the patient may develop, I mean, most likely it's okay, well developed esophageal viruses. So there's not much okay we can say it's okay life quality left. Because the next step maybe is okay, liver failure. Liver starts failing. Okay, guys. Now just take a short break and we're to be fair, I see you later, guys, back at 10:30. You guys are aware that you're coming to school tomorrow, right?
Yeah.
Everybody know where the school is? Okay, good. See you at 10:30. Come back, guys. Um, any questions?
No. Good. Now, guys, I think we already talked La Par earlier this morning, right?
Yes.
Good. So let's just go on to the next one. Which is going to be layering. which means okay, just means what we call okay, the voice box. Yeah, okay. But the word larynx actually is okay, comes from the word larynx, which for me is okay, will be okay, the name of the voice box. Now, guys, so again, it's okay here. It's okay. You can see it's okay that the X actually it's okay is going to be replaced by G. But then we can also say laryngeal, which is going to be it's okay the pertaining to. Now it may sound as okay, pretty crazy, but they actually also have okay something that would be called larynx. And okay, yes, we may have okay the combining vowels, so that's going to be it's okay what we'll use here. Okay, and we may say scope. So pretty much okay as a tool to visualize the larynx. Now guys, not at this point here is okay, but we can say it's okay, we may use a word called larynx. We may say it's okay, EL. And then we is okay, we'll just say straightforward cartilage. Because guys, what the voice box, as you may call it, or what the larynx actually is made up of, is going to is okay made up of 9 smaller or bigger pieces of cartilage. That actually is okay formed okay as a somehow as okay structure like this. And okay as what we have inside is okay, these cartilages here is going to be as okay your vocal cords. Or when we refer to as okay the cartilages that makes up the larynx, that can be called as okay the laryngeal cartilages. Okay, we will talk more about that when we get to as okay to the respiratory system. But the whole reason that we end up calling it the voice box is because it's okay within the larynx are what we call as okay the vocal cords. Okay, which means it's okay if that's okay. It's okay, just straps of fibromuscular tissue. Okay. And that's okay, that's how the voice is produced. But okay, a little bit more to that now. Okay. Any questions?
No.
Good. Now the next word is letter. Now some of you may pronounce it as later. Yeah, okay, it is spelled as later, but it's okay. It does not mean what later means in English. We said yesterday, it's okay means the side. Okay. It will be as okay accompanied with okay, yes. The suffix which is going to be lateral, which is just going to L, which is going to okay, just be pertaining to the side. And guys, what I said yesterday, because okay, this mainly is okay was we can say it's okay positional term, which means it's okay or mean it's okay per way or towards the side. So when you go, it's okay from the center in either this direction, you are going lateral, or this direction, that is going lateral. Okay. And that's why you may, as okay, also as okay at some point, or you may have heard the word to go and say yes, okay, by letter L. Okay. Whereas okay, lateral means okay will just be sorry. Lateral means okay will just be the sides on the side. And since it's okay that we use the word by, which means it's okay, would mean two. So bilateral chiral means okay, two sides, or in case some cases okay, both sides. Is that clear?
Yes.
Okay, so when you say bilateral, it's going to be as okay, both sides. Okay. This word here can also as okay be interchanged by what they'll call as okay, collateral. Which maybe as okay will just mean the same as okay as on both sides. Okay, so you can say it's okay, collateral damage, okay, yes. Damage on both sides. Or it's okay, collateral course or something like that. Did you guys get that?
Yeah.
Yes.
Okay. Mamma mia. Lump. Yes, okay, or that's okay, sorry, combining vowel. Okay. Now we can see, let's get the common words first. We can say lump, R. And this will be as okay, the pertaining to lump, which is going to be as okay. Or mean yes, okay, we'll call it okay, the line. Okay. If you want to go specifically and says okay, we can say it's okay, the lumbar region, the area of the line. Clear. You can even say it's okay, lumbar vertebrae, which was going to be as okay the backbones, where pertaining to your lumbar or loin or waist. I also is okay when we talked about is okay the meninges said that okay yes they may do what they call is okay a lumbar puncture. Now guys, the word puncture that means okay will be as okay a procedure in which is okay because it's okay a specimen is taken using a that's a needle. Okay. So mainly it's okay since here it's okay they go in between it's okay two lumbar vertebrae. Right. It means okay between it's okay L3 and L4. Where that's it's okay, we'll go in with a needle. And one needle is like a big fellow. It's okay, not try to, you should be able to, not you. So it's okay, get a specimen of the cerebrospinal fluid. Okay, now some of you may say it's okay, why L3 and L4? Or some of you may ask, what about the spine or spinal cord? Well, guys, it mainly is okay finishes at the level L3. So in the lower end of okay as your lumbar spine between is okay L3, L4, L4, L5, and all the sacral, you don't have spinal cord. Okay, so yes, okay, there is no pretty much okay. So you can say it's okay, no chance that okay as this needle here will be able to hit the spinal cord because if that was the case, that's okay. That would have caused damage to the spinal cord. So that's why they choose this area here to go in and okay, be able to just okay achieve a specimen of the cerebrospinal fluid and okay, yes, keeping the spinal cord safe. Okay, so they may call it as okay a lumbar tap. Some people may also call it as okay the lumbar or spinal tap. Although it's okay, they don't go into the spine. But you can say it's okay, maybe it's okay because it's okay, they're going into okay the spinal region or cavity of your posterior cavity. Did that make sense?
Yes.
Right. Okay. Now, guys, this will be as okay what they call as okay a lumbar puncture or a spinal tap or a lumbar tap. Now, some of you should have, but since you didn't, that's okay. Okay. How come nobody asked me then what in the hell is? So it is going to be as okay an epidural. Oh, guys, I mean, it's okay. It doesn't change. It's okay. Rule in him. Because you just have to, it's okay, make up the word here. So some of you may be asking or thinking, so what's the difference between a lumbar puncture and an epidural?
It's where it's injected.
Okay, first of all, that's okay. An epidural, yes, okay, is not something that means tapped, but it's rather to be, yes, okay, we can say it's okay. Because it's okay, an injection of whatsoever, right? But where is that? Now that's the L here is mainly yes, okay, just or yes, okay, pertaining to what? Dura or epidural. Clear? Okay, where here is okay, the dur, D-U-R, and okay, as practically E as well. Was going to be as okay. Dura matter. Okay. But where they don't go beneath the dura mater, but rather outside it, or that's okay. Right. So if you say it's okay, if this, for instance, okay, was your meninges, this is the dura mater, you can say it's okay. This was the arachnoidal layer. And we can say it's okay, we might have, okay, yes, the, for instance, pia mater. It was in the space between the dura, arachnoidal layer and pia mater that we had the CSFs. So yes, okay, for that, for a lumbar tap, they have to, yes, okay, put the needle all the way into the subarachnoidal space to, yes, okay, be able to, yes, okay, achieve a specimen of fluid. Whereas guys, okay, in an epidural, they, yes, okay, will not go in. I mean, yes, okay, just deposit the drug in the epidural space. And from here, yes, okay, it means, yes, okay, will just travel through the dura mater, arachnoidal layer, pia mater, and okay, let's get to the spine. And okay, once it reaches the spine, it's okay, that's when it will be just okay doing its job. Does that make sense? So the word epi, yes, okay, we used it earlier and says, okay, epi meant about. When we talk, for instance, okay, epithelium. Okay, so it can mean either about, or yes, okay, in some cases, okay, even around. Did you guys get that? No, guys, yesterday, we said something. We said that there was something called add, ren, L. right? Where I said that the word add meant close to. We said, okay, as ran here meant kidney, and of course, that's okay. L is our pertaining to, right? And why did we call it that? Mainly as okay, because that was something that was going to be as okay. That's ugly kidney. Because that was something which was close to the kidney. We call the structure here, okay, the adrenal gland. Right? But then I made as okay, took it a step ahead and say as okay, that it produce something like this, which just becomes just okay, adrenaline. Now, guys, there's going to be as okay a term that we call epi, which in this case, okay, actually now here just means okay about. And then there we go nepher, which may as okay no also as okay as a word for kidney, right? And then we just go in. So what do you have now? Epinephrine, right? Have anybody ever heard of epinephrine?
Yep.
Yes.
Have anybody heard of adrenaline?
Yep.
What does adrenaline do?
Speeds up your heart, right? Like it gets you going.
It gets you going. Okay, good. Yeah. Now, what may trigger your body to produce adrenaline?
Something
Exercise.
scary.
Pump it up. Exercise. Okay. What else?
Isn't it like a fight or flight reflex type of thing?
Exactly, the fight and flight and fright. Okay, the 3 Fs. Sorry, not that F. Fright. You get scared. Okay. Now there's 2 things to do in case of fright. Right, you say, well, okay, you know what, you're not going to scare me. Come out. That's the fight. Then there's other thing that you can do, flight. Pew. Take off. Make a U-turn and run the hell out of that space. Now in both cases, guys, okay, yes, what is it that you will need? A rapid heartbeat to keep you going. Or to, yes, okay, keep your hands going, right? Because you are now into, yes, okay, MMA situation, right? Okay, guys. It's okay, that fight and fright. So that's what we call okay, adrenaline. Now, have any of you heard of something called the oopsie, epi
An EpiPen?
yes. Yes. Have anybody heard of an EpiPen?
Yes.
Yes.
Good. Why do you think they call it an EpiPen?
Because it has epinephrine in it.
Exactly. And when do you give people epinephrine?
Allergic reaction.
Good. Not every allergic reaction. Pretty much okay as an allergic reaction, which is going to be referred to as anaphylactic shock. Clear? And the whole thing is in the word shock. Now, this is not a neurological shock. Right, okay? It's not a neurological shock. But here is more of okay as a circulatory shock. And when we say it's okay, shock in this instance is going to be that your body is not able to okay maintain a viable blood pressure. So what that EpiPen means is okay, it does okay, yes, it's going to okay speed up your heart rate. So what is it that they have in the EpiPen? Well, okay, epinephrine. But yes, okay, if you look at the constitution of what made up the word epinephrine is the same that makes just okay the constitution of adrenaline. So this is pretty much okay, just nothing different but adrenaline. Okay. But yes, okay, this gland here is still going to yes, okay, be called the adrenal gland. You can't call it the epinephrine gland. Okay. But it's okay if you look at them. Pretty much okay, yes. The same thing. Here it says okay, close to the kidney. Okay, the word here is about the kidney. And physically, as okay, if you look at the kidney, on top of the kidney, that's where you have this okay, the adrenal gland. Okay. So yes, okay, allergic reactions where people yes, okay, may need yes, okay, their EpiPen is, especially yes, okay, when they go into yes, okay, what they call NFI and okay, sorry guys, they call this okay, anaphylactic shock. This means okay, just type 1 allergic reaction where the thing is in shock. So most likely the patient may faint. Due to it's okay, not enough blood reaching to the brain. Okay, guys, mediastinum. We said yesterday. Now we can call it or we can use the word. What will be okay? Mediastinum. Where it's okay when we use the phrase or suffix medius okay becomes the name of the mediastinum. Or this becomes this okay the name. Or this whole word here becomes the name. Okay. You can say it's okay. Whoopsie. Well, guys. Media. Steinal. Okay, which just becomes pertaining to the mediastinum. Okay. Or we can say in this case, it's okay, which will become just okay, the mediastinal cavity. Okay. Which area did we call the mediastinum? The area between is okay, the two pleural cavities. That space in between the two pleural cavities is what we call the mediastinum. Okay. Or it could also be referred to as the mediastinal cavity. Clear? What we call the structures, organs that we had in the mediastinal cavity, what is going to be referred to as the mediastinal organs. Okay. Can somebody recall us, okay, what the mediastinal organs were? Any mediastinal organ.
Is it the heart?
Okay, good.
Some of the blood vessels, the superior and inferior vena cava.
Okay. Blood vessels. What else?
Your
esophagus.
throat?
Esophagus. Very good. What else?
Bronchial?
I will not go to the bronchioles, my dear. That will be in the lungs. You can just say it's okay, the bronchus. Okay. Which goes, and I mean, it's okay, just divide into, sorry. Bronchi. Yeah, bronchi was mean, that's okay, just plural, bronchus is singular. Yeah. Good. Good pelv. I mean, it's okay, just derived from the word pelvis. Yeah, when we go pelvis, we can even say it's okay, pelvic. Will just be as okay, pertaining to the pelvis. Okay. We can also use the word pelvic as a directional term, which means it's okay, or means it's okay, towards the pelvis. Which I mean is okay, said yesterday that okay, as a directional term, especially it's okay for your torso, is going to be equal to it's okay going inferior, which also could be infra. Provided that okay, as you're relating it to something which is above the pelvis. Right, okay. But we can also say it's okay. Now we can call it a pelvis. We can also it's okay call it the pelvic bone, which also is okay can be called the pelvis. But it's going to be wrong to call it bone, because okay, your pelvis is actually going to be made up of 3 bones on the right side, 3 bones on the left side. There's going to be okay a total of 6 bones, but they're going to be paired. Okay, so the 3 bones that you have on the right side are going to have equivalent counterparts on the left side. Okay, but it's going to be okay, a total of 6 bones that's going to make up your pelvis or pelvic bone. Okay, where each of these bones will be pelvic bones. Okay, so it's like I say, it's okay, your skull is now 1 bone, it's a total of 6 bones. Oh, I see. Yeah, 6 bones. Paired and unpaired. That makes up, yes, okay, the skull. Or cranium, as you call it. So they can be called the cranial bones. Okay. But then we also say, it's okay. Part of, yes, okay, your abdominopelvic cavity that falls as okay within that area of the pelvis would be the pelvic cavity, and what we had was okay as the pelvic organs. Okay, where some of them were as okay, mainly as okay, just continuity of okay as structures that we had in the abdomen, and somewhere as okay, we can say it's okay. Mainly it's okay, just organs by themselves, located in the pelvis. And areas of the, the organs of your reproductive system. Did you guys get that?
Yes.
Yes.
Now let me just go to yes, okay, to the word pharynx. I will take yes, okay, peritoneal and pleural together. So you can go pharynx. And it's going to be okay, G. Okay, yes, we may have it's okay, our combine vowel with O. Now, guys, as I said, it's okay here. This word pharynx here. Actually, it's okay. It's going to be derived from the word pharynx. Okay, so the actual word is pharynx. But as okay, if we use it as a root verb, where we may as okay, we'll have to as okay attach some suffix. The X is going to yes okay in this case again yes okay be substituted by a G, just as we had in larynx became larynx, right? Did that make sense?
Yes.
Good. Okay. Now please keep in mind, guys, it's only yes okay, most likely only yes okay when we attach a suffix after yes okay pharynx, that will pharynx become pharynx. And we can say it's okay, that's why we go and say it's okay, for instance. First, pharyngeal. So here's again, yes, okay. EL is going to be as okay. That means okay pertaining to. Just like as in larynx, we had laryngeal. Okay. Here is okay when we get okay as esophag. It became as okay esophageal. So they may think okay as that the GEAL, yes, okay, sounded correct. Or more chick. Okay, guys. Is that clear?
Yep.
Good.
Yes.
Now, guys, what does the word pharynx mean? That's going to be as okay, your throat. Okay. Okay, what you guys will see is okay when we get to is okay. The detail of okay is the anatomy of okay yes your respiratory system. That the pharynx or the throat actually is okay has 3 subsections. Clear? Okay. Where okay yes those names or subsections of the pharynx, or what we call the throat, actually is okay will be represented by okay as a prefix. So you may actually see that that's going to be something that we will call as okay the nas. So let's do it this way here. And then we go pharynx. So you see is okay here we don't change X out. So that's going to be as okay the part of your yes okay what we call is okay the throat that actually is okay is behind your nose. Then we go to yes okay what they call is okay, for instance, the oral. And we can say okay this O is kind of either be as okay on this oral or yes okay which is oral or mouth. And okay we can say it's okay This O here is okay, will be is okay. You are combining vowel, but then we go again and say it's okay. Larynx. And then the last is going to be as okay, what we call the larynx, which means it's okay, it's from larynx. We combine that with an O, but then the next part will just be as okay, the larynx. Now this one can be either be called the laryngopharynx, or we can also call it, so some people may also refer to as the hypo. And we know the hypo went, okay, yes, below. And okay, yes, pharynx is pharynx. Now, guys, usually when you say, yes, okay, I have a sore throat, will be pharynx, and then it becomes, yes, okay, it is. So pharyngitis. Any questions, guys?
No.
Goody, goody, goody. Okay, let's just take the next one here. And we can say it's okay, peritone. And in worst case scenarios, okay, combining. Oh. Or we can say it's okay, let's do it this way. Let's see. Peritone. So it's become just okay, the name of the structure here. Okay. But this peritoneum here can also be called the peritone. Peritoneal membrane. Oh, let me write that a little bit clearer, guys. If you can't read, just please let me know. Usually I try just, okay, speak the words out as I write them. So it's membrane, membrane. Or we can say, okay, membranes, because we had two membranes, right? Okay. And in between these two membranes, just okay, we had fluid, which we just said, okay, was called the peritoneal fluid. Now, earlier, guys, that's okay when we talk, that's okay, things such as hepatitis, especially that's okay when we went chronic hepatitis. Who says, okay, could also be, it's okay, what we call it's okay. Cirrhosis. or God forbid, yes, okay, in worst case scenario, yes, okay. Hepatoma. Now, guys, what you may, yes, okay, may be seeing or come across, that there's going to be patients, yes, okay, due to, yes, okay, extreme, yes, okay, hepatitis or chronic hepatitis, meaning, yes, okay, in a cirrhotic state, where, okay, yes, they will have too much peritoneal fluid. Now, there's too much of, okay, the peritoneal fluid that actually is, okay, is going to be, it's okay, what we can call it, okay, ascites. Some people may proudly call this my beer belly. Okay. Some people may proudly call this, okay, now this is not, this is a beer belly, and they feel proud about it. But it's okay, guys, in some instances, okay, this the abdomen may actually, it's okay, become so distended that, okay, as that 65-year-old gentleman, yes, okay, may look like he is pregnant. Now, first of all, yes, okay, men should not be pregnant. And especially not when they're 65-year-old. Okay. Women should not get pregnant when they're 65-year-old either. Do you guys know the word called of the oldest pregnancy? Of a woman? No idea. I think it's 62 or something like that. Yes. So, yes. Here's my grown-up son. He's 48. And here's his brother, who is 4 months and 8 days. Just playing, but like, okay, what the blue, right? Um, good. But yes, okay. So actually, that's okay. See a picture of that, and it's okay. What the hell? Figure 213 in your book. Okay, so that's okay. As I say, it's okay. Many people say, no, 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 this is. They will probably, yes, okay, call yes, okay, this is my beer belly. They know that they got something like this because of too much beer or alcohol or drugs. But that fluid needs to be tapped because he or she, yes, okay, may have, okay, as difficulty in breathing due to, yes, okay, that over distended abdomen. Okay. But guys, it doesn't have to be, it's okay, 62-year-old men. Even it's okay in, well, okay, I won't say young, but it can also, it's okay, be seen in children. Mainly because it's okay, they contracted hepatitis in an early age due to whatever reason. We're not going to go into that. But it's okay, mainly became chronic. Okay. So, yes, okay. So that may be, yes, okay, where you guys will be involved because, okay, there's somebody with a big belly. And your job may be, yes, okay, to, okay, sorry. Hold the transducer to scan, so that somebody is okay with a big needle and go in and tap out. Not all, but at least that's okay. Quite some big amounts of this fluid here. And then you guys will say, then what? Well, okay, at some point, that's okay, the patient will come back because the fluid just developed again. So there's not much else to do, yes, okay, than to, yes, okay, tap off the fluid as it. Right? But excess of that in, yes, okay, peritoneal fluid is mainly, yes, okay, what we'll call ascites. So yes, okay, the person will have, okay, yes, a big belly. And what you actually will see is that, okay, the pressure inside the abdomen actually is going to be so extreme that it's going to just, okay, flatten out the belly button. So you will not, well, you can say, well, there's something here that looks like, okay, this will be, yes, okay, where the belly button was. But it's okay. You really won't be able to see the belly button as such. Okay. And I don't need to, yes, okay, know about, yes, okay, the anatomy of your belly button. Once I was talking about this, one of my students go and say, okay, but my belly button is an innie. And I go, what the hell is an innie? Right, okay. What's an innie? And she goes and tries to say, explain what it is. Okay, guys, enough. Enough details of, okay, that's what your belly button or yes, okay, umbilicus looks like. So yes, okay, such as great pressure, yes, okay, or we can call it, okay, intra-abdominal pressure. Increase of the intra-abdominal, like actually presses on, yes, okay, the abdominal wall, okay, to make it appear distended. Yes, okay, of course, as we said that yesterday, that okay, yes, okay, we can even have, okay, we can call this, okay, withdrawn. Itis. Right, okay. Now, guys, me is okay because, okay, I want to just talk a bit about this. So see this here is okay, we can go to the plural or plural. Okay. Which means yes, okay, was what is okay derived from the word plura. Which was okay, yes, again, it's okay that two-layered membrane that covered the lungs. Right, okay. Now what did we have in the pleural membrane? Which was made up of two layers. In between that is okay, we had pleural fluid, right? Okay, now you may hear me say it again and again and again. That okay, as good is good, but then okay, as too much good is bad. So in the abdomen, if you find that's okay, when we had too much of peritoneal fluid, that was what we call ascites. In the pleural cavity, in the pleural membrane, if we had too much pleural fluid, that is going to be what we will call a pleural effusion. And go something that as we may get on to but in a later chapter. But when you see the word fusion, now I know some of you may think of as a genre of music, but that's not what we're talking. This term here most likely is it's going to have something to do with fluid. Or when we say fluid, that's liquids. Right, okay. So normally speaking, guys, we said as we can say we have the lungs with the pleural membrane around them. We can say just the normal amount of pleural fluid. But God forbid that yes. Well, we can say we still have yes the pleural membrane. Let me just take this one lung here. But yes, where there's going to be too much pleural fluid. You can see what that is going to do to the lung. Not giving her room to expand. So this again is going to cause that the patient will have difficulty in breathing. And what do they do then? Scooby-Doo, what do we do? Again, with the help of a needle. Tap this fluid out. But we can make sense, here that collection of fluid in the pleural space. Or yes, in between is the pleural membrane. Or yes, excess of yes, pleural fluid is going to be called a pleural effusion. Did you guys get that?
Yes.
Yes.
Okay. Now, the reason for a pleural effusion itself can be what you call pleuritis, inflammation of the pleural membranes. Other thing can other reasons could mean is mainly it's due to something going on in the lung. It can be a lung tumor, cancer, whichever you want to call it. That can cause leakage of fluid from the tumor into the pleural space. It will cause more and more fluid accumulating. Yeah, okay. It's also commonly seen as in certainly as lung infections. Okay, that the patient actually is will develop as what you would call is a pleural effusion. Or maybe meaning is a pleural effusion means excess amount of pleural fluid in the pleural space. For more details about this and some other things just related to accumulations in the pleural space when we get to the respiratory system. Clear? Okay, and some of you may say that, Mike, what about, yes, okay, the other P membrane that we had? Pericardium is, of course, also again, the pericardium, we also had, okay, as pericardial fluid. Right? Okay, yes, okay, what do we then call, yes, okay, excess amount of, okay, as fluid in the pericardium, or excess amount of pericardial fluid? Well, guys, that is just going to be called, yes, okay, the pericardial. Okay, it says, okay, here it's okay, we use the word L because of changing to. And of course, guys, okay, yes, we want to make it easy. So that's just going to be called as, okay, a pericardial effusion. Again, is okay here, of course. It is just fluid. Did you guys get that?
Yeah.
Yeah.
Any questions, guys?
No.
No.
It. Everybody clear about the post? Everybody clear about the post? Post.
Yeah.
Now, what does the post mean?
Like behind or the back, posterior.
Okay. Or after, right? What else is also known as a post?
Dorsal.
Okay, so that's another word for posterior. Okay, what else is also known as a post? Let me check your guys' vocabulary. What else would you also call a post? Or the post?
Caudal? Are you looking for another word for it?
For post.
Yeah. Caudal or I'm not sure how to say it, but means tail. Caudal.
Caudal, okay. No, that would be inferior, my dear.
My bad.
Oh,
Retro.
okay. But we are done with the behind things. When you see the post, or when you see the word post, what else can it mean? Later on, earlier we said late or later. Well, okay, in terms of position, we call it towards the side, right? But what's another meaning for later? Let's talk
After.
about this later, right? Right? So my question here is, okay, what's another meaning for the word post? OMG. Is this real? Girls. Now, guys, why should I keep crushing out of this?
Lateral.
Oh, why would post mean lateral? We're done with lateral. Yeah, you went too far back. You went so far back that you got to the side. OMG, what does the mailman bring you? What does the mailman bring you?
Mail.
Huh?
Mail.
Okay, what's another name for that? If you need to send the mail, where do you go?
Post office.
Okay, here we go. Good. What's another meaning for post? So that's okay. Your mail can also be called a post, right?
Are you looking for posterior?
Be done with positions.
Okay.
Okay.
Are you looking for words that have post in it?
No, I'm just looking for
Okay.
another meaning for the word post.
Like the opposite meaning?
No, just another word for post or a meaning for post.
To send.
Okay, we send the mail, we post the mail. Okay, good. Okay, I guess none of you have seen military documentaries or something. A place where a soldier is asked to stand and guard would be a post. You guys didn't know that? This is your post. This is where you're going to, yes, okay, you're going to defend this. Okay. Just like, okay, guys, in regular English, it's okay, we say later. Or actually, we pronounce it later. Means, okay, let's talk about that later on, right? But here is okay, lateral means something else. The side, right? That's why we go lateral. Okay, now what's going to be the opposite of post? Now we can talk medical terms again.
Anti?
Huh?
Anti?
Anti, not which anti?
ANTE?
Okay, good. Because if you go ANTI, it becomes
Becomes
ANTI.
anti
Against.
Okay, which is going to be
against.
against.
Mhm.
Okay, good. So guys, I'm going to, yes, okay, increasingly being, yes, okay, asking, yes, okay, things out like this. Okay. Good. Now let's just take the nextus verdus. And that's when you go, oopsie moopsie. Ready? Or actually, that's okay in this instance. Yes, okay, we'll say that's okay. Say radio. It's probably not going to be correct to say X-rays. Okay. But okay, we can put it this way. Because okay, here's okay, the radio. Actually, it's okay, yes, from what it's okay, we'll refer to as radiations. The X-rays, for instance, okay, just is one type. Now, guys, back in the days, they may still, yes, okay, use it nowadays because, okay, you may see, yes, okay, radio. Oh, And then we're going to just, okay, look at a word that we haven't talked about in a little while. Radiology, right? Okay. Now, guys, back in the days, or they may as okay, still yes, okay, use the word radiology. Even yes, okay, in some places nowadays. Okay. But back in the day, that's okay. They mainly as okay used as okay the word radiology. Mainly as okay to as okay say as okay the place where they actually where they take X-rays, CAT scans. We also call these CAT scans meow scans. Okay, okay, MRIs, so and so. Okay, so that department or that specialty in which it's okay, where the patient or the person mainly is okay does nothing but sits and looks at different scans or images was going to be as okay radiology, or he or she was going to be a radiologist. As a matter of fact, guys, even as okay you were ultrasound comes under yes okay the umbrella of radiology. But guys, in ultrasound, yes okay there's no radiations. Or we can say it's okay, no X-rays. So that's why it's okay. In many cases, it's okay. The meaning is okay. Have replaced the word radiology by, sorry, diagnostic imaging. But it can mainly say it's okay that here is okay. The diagnostic is mainly it's okay because okay it's pertaining to diagnosis. Okay. On this sense, there's okay something that okay will help us with us okay is going to it's okay be related to it's okay get to a diagnosis. Or what is it that we use in diagnostic imaging? It's images. So it doesn't really matter whether that was an X-ray, whether that was a CAT scan, whether it was an MRI, a PET scan, even yes okay an ultrasound. Because okay, what is it that you get in an ultrasound? Even yes okay some sort of picture or image that's going to just okay be looked upon, and somebody will say, okay, what did I say? My eyes spies or something like that. Have you heard of that game? Something that's green. What is that? What is that they say? Nobody played that game?
I Spy.
Yeah.
Okay,
Mhm.
but it's okay for yes okay to be able to yes okay find the blue clues in the image. Okay, you have to have the Sherlock Holmes eyes. Okay. And that's pretty much okay is what you guys signed up for. To get Sherlock Holmes eyes. So that your eyes will be able to spy. Or you can say, okay, pick up the clues. But is it going to be you guys who will give the patient the diagnosis? No. Okay. So that's okay. What used to be called radiology back in the days, in many places now it's just called diagnostic imaging. But even if they say radiology, it's still going to be as okay the department where yes, okay, they use different modalities to create an image. Okay, mainly because okay, for most of yes, okay, things such as CAT scans, X-rays, etc., etc. What you still get is going to be as okay, what we call as okay, a radio. And we still get as okay, yeah. O and okay, yes. Graph. Yes, okay, the graph means yes, okay, the image. Of using what? Yes, okay. Not a radio where you play yes, okay, FM 101 or something. But it's okay, radiations. And the first radiations to yes, okay, be discovered was the X-rays. Do you guys know the guy who discovered the X-rays? What his name was? Yep. Okay. Do you know where he was from? And I will take a continent as an answer. That's fine. You don't have to go to a specific country. No? No, he was from Europe. Now, since I give the answer, I'm going to say yes, okay, he was from Germany. So yes, okay, a lot of discoveries in, okay, yes, we can say modern medicine. Always okay, was modern back then. A lot of things were discovered by the Germans. So yes. Okay. Okay, guys. Then some of you may have heard of something that they call, and that's probably as okay why they went off and just okay from radiology, and okay, as I can mainly change that into diagnostic imaging, because there's another word that is going to be that we will call radiotherapy. Now, guys, yes, okay, it's always pronounced radiotherapy. Okay, but this is still yes, okay, just you're combining well. You can't take it together like this and say, okay, well, okay, yes. We just play as okay a favorite station for the patient, and that is going to just okay treat him or her for her from their condition. Because the word therapy mainly is okay, so it's a fancy word for treatment. So guys, radiotherapy, that is mainly as okay where they use radiations to treat. And treat for what? Treat for cancer.
Cancer.
Exactly. Okay. So pretty much okay as strong radiations. Okay, bombarding the tumor with that. And what is that going to do? Kill the tumor cells. That's why it's targeted. You don't go like that. Because you only want to target is okay the cancerous cell and kill those. Now, it may sound crazy, but it's okay. A lot of the substances that they use in radiotherapy are not primarily as okay, or when they as okay first started as okay thinking of okay radiotherapy. The intent was not, or people who invented yes okay a lot of these radioactive substances, we want to put that way. The intention was not to yes okay create a medication yes okay something that could be used to treat medication yes okay to treat cancers, or be used as a type of drug, but mainly as okay to yes okay make a more deadly nuclear weapon, atom bomb. Now, okay, guys, they're not going to drop an atom bomb on your heads if you go radiotherapy. But like, okay, the guy is going to be as okay, small doses. Why don't they give you as okay a big dose? Because okay, that may be as okay too toxic, and that can cause the person to get deadly sick. So that's why they gave you as okay in small installments or small doses. They go, "Beep, beep, 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 beep." Okay, yes, come back in 3 weeks, come back in a month, come back in whatsoever, whatever the protocol says. Then you come and okay, and then yes, okay, they're bombarded. I mean, it's okay, just slowly, it's okay, try to kill as many cells as possible of the tumor, and okay, in that way, cause the tumor is okay to become smaller. And then I guess okay, we can take the remaining with drugs. Okay, and what do you call that therapy then?
Chemotherapy?
That would be chemotherapy. Okay, well, the word chemo means okay, just come from chemical, which is going to in this case, yes, okay, be a drug. So therapy is mainly it's okay, just a fancy word for treatment. Okay, guys, now just take your lynch brick, and when we come back, just okay, we'll talk about the S, the T's, and the V's. So should I say that I see you guys back at what time? Don't be mute. I haven't killed anybody if they come up with a suggestion from what time they want to be back.
Whatever time to learn everything we need for the quiz tomorrow.
I
Whatever you,
remember.
I said whatever time you think for us to learn everything for the quiz
Well,
tomorrow.
okay, my dear, if you have been paying, yes, okay, 25% attention to what I've been talking about for the last week and a half, you should be good.
Okay.
If you are able to answer most of the questions at the end of the chapter, you should be more than good. Okay, now guys. Oops. You almost got recorded. Almost. Okay, guys.
Good.
And that's why it's okay. Okay, sorry. When we say radiotherapy, you may hear the word nuclear medicine. Have anybody ever seen that term?
Yes.
Okay. That's mainly because that's okay. In this case, that's okay. What is it we do? We nuke the tumor. Right, okay. we nuke the tumor. So, okay, good. Let's go on to our next term, guys. And what do we have? Now, guys, be careful. Because we can say it's okay. And okay, when I was killed this here. Stacker. And okay, as if needed as okay, maybe with a combining vowel. And we said that sacker. I mean, it's okay, derived from it's okay, the word sacrum, which was mean as okay now, since it ends with mean as okay is the name, because it becomes okay the name of what the sacker will be. But in this case, we could also say it's okay the sacker L pertaining to the sacker, which was those, that's okay, 5 vertebrae. Okay, off the lower back. Yes, W is okay because that's okay, the sacral vertebrae. Now, although it's okay, it's a count of 5, but it's okay, they were fused together. And pretty much okay, as this. Okay, it may look something like this. Here you see it in real life. Okay, W is okay, your sacral vertebrae fused together. And what the meaning is, okay, what I have here is going to be okay. Some 5 filaments. You may, yes, okay. Now, if you look at the posterior side of the sacrum, yes, okay, you may see, yes, okay, some small ridges. I got a small ridge here. This is mainly as okay, just the remnants of okay, yes, your vertebral spine. I want to call it okay, the spinous process of your vertebrae. Up in the neck and okay, yes, at your lower back when you slide your finger in the middle of your sacrum or of your spinal column, you can actually okay feel the spinous processes. Okay, in your upper vertebrae. And okay, but what we then just have okay as inferior to this is going to be as okay, small as okay, 3 to 5 small coccygeal vertebrae. Okay. So that's what you call the sacrum, which is made up of the sacral vertebrae. Okay. Now, guys, what this fellow here is okay will be doing is okay, it will actually is okay make joint with okay, yes, one of the bones of your pelvis, which is going to be as okay the ilium, from which it's actually is okay get iliac. Okay. And mainly because okay, this joint here, for instance, is a joint between yes, okay, the sacrum and the ilium. Actually is okay what are referred to as the sacer. And here is okay, that's where you is okay, may use as okay, the combining vowel. And then go as okay, now from ilium, that's just the name. We go and say as okay. We'll say iliac. Whereas, okay, we can say, okay, yes, okay, ilia is from ilium, and the egg is okay, will be all pertaining to. And okay, of course, that's okay, since it's the point where it's okay, the joint that's going to be, okay, or the joint. Okay. Where, okay, yes. Okay. So that will be, okay, your sacroiliac joint. Did that make sense?
Yes.
You mean you can say, okay, it tells you it's the joint between the sacrum and the ilium. Yeah, okay, ilium is okay, is going to just okay be one of the 3 pelvic bones. So that going to be okay, 2 other bones on the right side, and there's going to be 2 other bones okay on the left side, which will make okay a total of 6 bones that will form also the pelvis. Okay. But the sacrum is not a pelvic bone. But okay, because it's not a part of the pelvis. Although it's okay, it makes, you can say, the posterior boundary of your pelvic cavity is actually going to be made by the sacrum. Now, guys, please, and okay, yes, it's just okay. We can say it's okay, a slight twist of the letters, because we say sacre, S-A-C-R. Well, okay, we're going to be as okay the sacrum or sacral. Whereas if we go S-A-R-C, that becomes flesh. Right, okay. Where we said, okay, as this word here, sacre or sark, primarily as okay will be referred to as okay, will be related to as okay to your muscles. Where we say that muscle is okay is flesh. Next is okay, this term here, sarc, S-R-C, S-A-R-C, sorry. Okay, could also as okay be used in context to connective tissue. Especially as okay in China, as okay when we talked about tumors or masses. So we can just take them all and okay, let's see. Now pretty much okay, yes, now just muscle. The technical word for muscle is going to be myo. Yeah, okay. So we can say it's okay. Non-cancerous tumor. And cancerous tumor. Now we are going to call it a myoma. And a myosarcoma. Bah. Clear? We can say it's okay, bone. Now for bone, the technical word was osteo. So we call it an osteoma. And osteo sarcoma. You can take the next one and say cartilage. The word for cartilage was chondr. So we can say that's okay. Chondroma and chondrosarcoma. We can say fat or fat tissue. Now here it's okay. It's going to be as okay lip. And that's why we say it's okay lipoma. Although this fellow here is okay, the second one here is pretty rare. But it's okay, never say never. So that's going to be as okay liposarcoma. Did that make sense? Where we can mainly say that okay as these three here. Or mainly as okay, just examples of connective tissues. Non-cancerous or benign tumors, cancerous or malignant tumors. But yes, okay, guys, please make sure that you guys, okay, know the difference between sarco versus sacro or sacro. Did you guys get that?
Yes.
Yes.
Any questions?
No.
Good. You can say spin or spinal. Okay. Now let's just go first and say that's okay. Spine. Now, pertaining to the spine. Something that we've been talking about is okay in this chapter here was okay as the spinal cavity. Right, okay. We could also say some people may call it as okay spinal prolapse. That's for also as okay. In some cases, we'll refer to as okay as a discus prolapse. Okay, and what mainly as okay happens here is not really the spine, but it's rather as okay the intervertebral discs that prolapses, or you can say it's okay herniates. So they may even okay call it as okay herniated disc. Now we can mean it's okay just if this was a vertebra, this is a vertebra. And we can say, okay, if this is the posterior side, this one it says, okay, becomes the anterior side. And what we mean is, okay, how on the anterior side is going to be, is okay, so this is here is okay, where your spinal cavity runs. Mainly because, okay, there's going to be a part of, okay, yes, of your vertebrae. They're going to, okay, come off the vertebrae, circle around from both sides. Okay. And circle, and that means that's okay. That means that's okay, is what's going to, that's okay, we can just, okay, make the cavity, that passage. But it's okay, what we have in between is okay, the vertebrae or your intervertebral disc. And that may prolapse. Now, practically, okay, there's a difference between it's okay, prolapsing and just herniating. Because usually what just happens in prolapse is that, okay, as the space between, yes, okay, the two vertebrae, above and below, is reduced. Mainly because, okay, the disc itself, yes, okay, may get compressed. And what that mainly causes is that, okay, yes, because in this area here, that's going to be, okay, an opening. And it mainly is, okay, through this opening here, that, okay, yes, the spinal nerves comes out. So that causes that, okay, yes, that actually is, okay, will be more or less, okay, yes, continuous pressure onto the spinal, onto the nerve. And that can lead to ouch, pain. Whereas usually it's okay, guys, when we talk of, okay, as a herniated disc. In this same, yes, okay, instance here. Oh, that's probably going to be a wrong color. Let's do this. Then we see it's okay, a herniated disc. This disc here actually is okay. That the disc that we have actually is okay, is, sorry guys, gotcha, is okay, protruding out. And actually it's okay, we'll be pressing up against the spinal cord. And of course, that's okay, this here also can be ouch. Right? As far as, okay, as the clinical picture is concerned, that's okay, it's going to be the same. Whether it was a prolapse or whether it was okay as a herniated disc. So usually it's okay. They will do an MRI for things like these and say, okay, is it a disc that has herniated and is pressing onto the that's okay, spinal cord, or is it just because the disc? I mean, it's okay. You can say, okay, it's okay, whatever. It's okay, has prolapsed. That the distance between is okay, the two vertebrae is reduced, and that causes narrowing of the passage through which is okay, the nerve passes out, and okay, yes, causes a pressure on the nerve. Okay, so that's something else. Okay, that we used to, yes, okay, deal with when I was working at a neurosurgical department. So but generally, it's okay. Spin or spine is mainly, it's okay. Just going to refer. Yes, okay. The whole, it's okay. This means, it's okay. You were backbone, but that's okay. In the backbone, it's okay. We have a cavity which we just call the spinal cavity. Yeah, we even said that, okay, yes, in this spinal cavity, we had something that we call the cerebrum. Now here, it's okay, it's going to be cerebrum. Always going to be, it's okay, you're combining vowel. And then we just go on to, it's okay, to the next word. That will be spinal. As okay here. This means okay, just becomes just okay, the pertaining to, yes, okay, the whole cerebrospinal. Okay, both cerebral and spinal. Rather than say, yes, okay, cerebral or spinal. Okay, why make it as okay more confusing than it is? Okay, guys. Any questions? And of course, yes, okay. We had the fluid. Any questions?
No.
Any comments?
No.
Nope. Thoraco. Or we can say it's okay, thorac. Which mainly as okay means chest. But yes, okay, guys, as you may know that okay, yes, the thorax yes, okay, comes from the word thorax. Mainly yes, okay, because okay, if you use this here as a root word followed by a suffix, we will use the term thorax. And okay, as we may have okay as our combining vowel. Whereas if we use thorax as okay as the word itself, mainly as okay, just only as okay, preceded by a prefix and no suffix. We got just okay, use the term thorax. Clear? Okay. So we can make this as okay if we use thorax. We can say okay, thorax. Ick. But actually it's going to be pronounced as thoracic, pertaining to the chest. And okay, as we have been talking about that ever since we started this chapter, thoracic cavity. Okay. We can even say it's okay. Now there's going to be it's okay where we can say it's okay, thoraco. Or we can say okay, thorac. Oh. And here it's okay, we'll just use okay, yes. Oops. Thoracoscope. Okay. So while that be as okay, mainly as okay, visualizing tool used to visualize the mainly as okay, your thoracic cavity. And when you do it's okay, use a thoracoscope, you are doing thoraco. Scopy. Did that make sense?
Yes.
Yes.
Good. Now, probably a word that is going to just come up at a later instance. Since we still are at thorac, we can say thorac. Oh. And the word that we will be using here is going to be scent. He says. Now, what you guys will be is I should be able to guess by now that since we end up with cis, this is going to be a process of a procedure related to to the chest. Now, does anybody know what the word scent means?
Is it a unit of measure?
Okay, good. How much would that be? I guess you girls don't like money.
Is it 100?
So what would a cent be? A penny, right?
Yeah.
So what is thoracocentesis if you look at that? The process in which, you drop a penny into somebody's chest. Who in the hell would do that? I heard of this, throwing a penny in a fountain. Penny or a quarter or whatever, all depends upon how serious you are about your wish, right? Nah, okay, guys, listen. This verse sentences here mean is where there's again, we'll go with the needle and pretty much as aspire fluid or change is fluid out from the what you want to call it. In this case, it's your thoracic cavity. So this scent here has nothing to do with pennies. Not to talk about $100. But synthesis is mainly as just the process of what we can call aspiring fluid out from the thoracic cavity. Now here it is indistinct. It could be from the pleural cavity. It can be from the pericardial cavity. It can be from within the thorax itself. Not in the pleural cavity, not in the pleural membrane, sorry. Or the pericardial bias, fluid that has accumulated inside the thoracic cavity itself as well. Okay.
So it's letting excess fluid out of the thoracic cavity.
Pretty much.
Okay.
Okay. But we can go and say as if you do the very same as on the pleural cavity, where you mean is just aspire fluid, pretty much as from a pleural effusion as I talked about. That will just become pleural synthesis. If you aspire fluid from mainly you can say from a pericardial effusion that's going to be a pericardial synthesis. So the word synthesis means okay, just the process of aspiring fluid out. So we talk about more as okay varieties of synthesis when we talk about this specific term here as a suffix. But what you see here is okay in all these cases okay here, since we is okay attached or is okay put on suffixes to yes okay or root word which was thorax to begin with, but we used the thorax version of it. Did that make sense?
Yes.
Right, okay. There, okay, so if I use, well, okay, still thorax or thorax, but if I put, okay, it's only a prefix in front of it, it's going to just, okay, end up with using, yes, okay, the term thorax. I can just, it's okay, take one example. And we can say it's okay. Now what we're doing is, okay, just putting a prefix in front of it. And now we can say, okay, that would be yes, okay, and new. And then here's okay, this would be yes, okay, our combining vowel. Mean is okay, combining between us, okay, this, which is a prefix now, or it may be as okay, a root word itself, but used as a prefix for thorax. But here's okay, the word thorax means okay, just means chest. Now, new, I said, although it's okay, it may as okay be related to as okay breathing. But the actual original meaning of new was ear. And that's what we are talking about here. So pneumothorax doesn't mean yes, okay, breathing in the chest or something. No, that's going to mean yes, okay, be that we actually have free air inside the thoracic cavity. Did that make sense?
Yes.
And some of you may say, well, okay, there's more air for the lungs. Well, okay, not really, because that is going to just, okay, build up a pressure inside the thoracic cavity. So the patient actually is okay, will have a heck of a issue with breathing. And some of you say, so how do you correct that? That's okay, stepping the patient now. That's that. Mainly, it's okay. That's okay. Well, okay, not really suck, but okay, yes. You puncture a hole, and okay, yes, it's going to just okay, slowly, it's okay, be just released under what we call underwater seal. Because that air most likely is okay, came from a punctured lung. Otherwise, there was no reason why a patient should have free air inside the thoracic cavity. And especially not in a mouth that is going to just okay, build up a pressure against the lungs. Okay. But my main thing that I just wanted to just okay, show you guys here is okay, that we use the word thorax, which was okay, the original that meant chest, as the last word in our sentence, in our word here. We use thorax and not thorax. So it's going to be pneumothorax, not pneumothorax. Is that clear?
Yes.
Yes.
Yep.
Good, guys. Now, although it's okay, not mentioned here, and not as okay, not really as okay relevant either for now at least. But it's okay. The word chest may go under it's okay another name. And that is going to, yes, okay, be Pector. Not Petco, but Pector, or Pector. Pector. So some of you guys may have heard of, okay, yes, what people commonly call chest pain, right?
Yeah.
When do people have chest pain? When is it that people will have chest pain?
And they have trouble
Sure.
breathing.
Okay,
If they're having a heart attack,
heart attack, exactly. Now, some of you may have heard that, okay, yes, they call this chest pain here. Angina, right? Didn't you know that?
yes.
Good. And okay, be careful because it is angina, it is not vagina. Okay. And the reason I say that as well is, okay, as I have people I heard that's okay, somebody is okay, call this thing here vagina. There's a hell of a difference between this and a vagina. Okay, but even yes, okay, this is mainly as okay, just the short form. Because the actual term is going to be as okay, angina, also angina pectoris. That's the complete word for what we call this chest pain here. Okay, we can say it's okay, the pectoris here is actually it's okay, just the pain. That's okay, sorry, chest. Which comes from the word pector, which is chest. Did you guys get that?
Yes.
Mhm.
Okay. Okay. C. Now just the last term. Trache. Yes, okay. If we need it, yes, okay. We're combining vowel O. Okay. So trache. Okay, I mean yes, okay. Just going to yes, okay. Derived from yes, okay. The word is just being short from okay, yes, called it trachea, which is just okay as the name for your as okay in English we may call it as okay the windpipe. Okay. And we can say, okay, that's maybe it's okay going to be the part of your airway that runs between. Now we can say, okay, about the trachea. Sorry. Here. Yeah, the larynx. Then we have, okay, as the trachea. And lower to the trachea is the bronchus. Yeah. Now, guys. So trachea, shorted, trachea. Now we can say it's okay. Trachea L. We can say, and okay, yes, now let me see, trachea, now primary, yes, okay, this guy here, sorry. Trachea mainly is going to, yes, okay, be made up of rings of cartilages. Yes, okay, we can actually, okay, tracheal cartilage, which means, okay, just going to be, yes, okay, the rings of cartilage that makes up the trachea. We'll talk more about that in the and then majority of your sorry guys, your respiratory system. Okay. Now you may see as okay a picture in your book where this is okay making an opening like this. Now, since it is going to be as okay an opening, and it may sound pretty violent, it's going to be as okay a trachea from the trachea. O as our favorite combining vowel. And now here's okay, I will be using two words because I mean it's okay just making the cut into the trachea will be called a tracheotomy. Now somebody may say, why would somebody do something like that? Well, okay, guys, if somebody is choking on something because they found it was fun to just okay suckle on a penny, a nickel, a dime, a quarter, whatever. And before it, okay, yes, it goes down and gets stuck in the airways, blocking the air passage. Well, okay, the only way to get air would be just okay via tracheotomy. Until yes, okay, that penny, nickel, dime, or whatever has been pulled out. Is that clear? So here's okay, what actually is okay, we'll do is, yes, okay, stab a puncture hole into the trachea, that what we call a tracheotomy. Now, guys, I may say something. Have any of you seen that advertisement on the TV, which is actually it's a campaign against smoking?
Yes.
Okay, Christina, what does that advertisement show?
Isn't it like when they were like showing when they have that thing on their neck to like help them talk?
Exactly. Okay, so what the media will have is more of okay as a permanent opening. Now that thing may as okay now to be decent. You can say it just looks like a microphone. Physically, it's okay. It looks like a microphone. Wherever they talk, they have to put it up against that. It's okay. That opening in the trachea. Okay, so that's okay. In some cases, some people maybe it's okay stuck with a tracheotomy forever. Or that opening, yes, okay. If you look at it next time you see that advertisement of yes, okay, you can look it up in the. It actually is okay. May look like a mouth. So it's okay. That tracheotomy actually is okay. Can now be referred to as a trachea, which is trachea. Here we still yes, okay. Use a combining vowel. We can still say it's okay now. Well, okay, just so you guys can see it's okay. That's going to be it's okay. Tomi is the same word, but here it's okay. It's just going to be one single letter that is going to it's okay make this become it's okay give a whole new meaning. Because here it's okay. This stomy actually is okay come from the word stoma, S-T-O-M-A, which means mouth. So mainly it's okay because now you have this mouth-like opening. It's going to, yes, okay, at the trachea is going to be called a tracheostomy. So I think in the next chapter, guys, we will talk, probably it's okay in the next chapter. We'll be talking about, it's okay, a whole other bunch of different stomies. But what is that a stomy is? It's mainly as okay, they're going to be as okay, mouth look alike opening. Now, some of you may already have heard of, okay, it's a stomy like that. No? Have you guys never heard of a colonostomy?
Did you say colostomy?
Yes.
That's the bag that goes on the stomach.
Well, okay, that's the bag, but where do they put that bag on?
The colon.
Okay, usually the colon will go to the sigmoid and the sigmoid to the rectum and the rectum to the
Anus.
dick. So the main is okay, have an opening made in the abdominal wall through which that's okay, an end of the colon is taken out. And instead of passing, that's okay, their poop or feces or stools or whatever you want to call it, through the normal route, is mainly is okay going to come through that colostomy, which means it's going to be as okay, colon because it's from the colon. And stomy mainly is okay because if you remove that bag here, you will see is an opening like this. That looks like an open mouth. And okay, yes, there's not going to be as okay words of medical terminology coming out of that mouth, but rather, yes. So guys, these were the first two chapters. Good. Now I hope you understood the words that came out of my mouth. Have you guys seen that one? Big Brothers? You guys haven't seen that movie? Well, the name of the movie is not Do You Understand the Word That Comes Out of My Mouth? That's going to be too long of a name. What is this guy? Chris
Tucker.
Rock?
Chris Tucker.
Ah, yeah, here we go. Chris Tucker. Yeah, sorry. Okay.
Isn't that Rush Hour?
Rush Hour, Jackie
Yeah.
Chan. Do you understand the word that is coming out of my mouth? So yes, okay. If you understood the word that came out of my mouth, I don't see why you should have an issue tomorrow. Okay? Okay, guys, listen. Again, off the record.